On this episode, we will be talking about coffee. We'll also be talking about pain in your tailbone, and we'll talk about if you can get a gastric sleeve if you had your gallbladder removed before. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 194 of the AskDrA show. Thanks so much for joining us, and if you're new to the show, you might consider subscribing to this channel. If you're interested in weight loss surgery, if you're interested in weight loss in general, if you're interested in gastric sleeve technique, this is what we do. Also, if you can hit one of these, greatly appreciate it. Helps me a lot. And very interesting questions. So let's get into the show. Okay, so our first question is, can I have coffee after surgery? Short answer is yes, but there's a but. But when? All right, that's the timing. So in our case, we suggest patients they can have decaf coffee right away, right after surgery, once they start doing their phase 1 of clear liquids. And then once they start doing phase 2, which is thicker stuff, creamy soups, drinkable yogurts, they can have regular coffee. You might check or you might want to check out those guidelines of your own doctor's practice, because this of course may vary. In our guidelines with our practice, decaf the first week, and once they start phase 2, they can have regular coffee. Okay, question number 2, this is a frequent one, very, very common, is my tailbone starts to hurt. What can I do? Is this normal? The answer is yes, it's normal. Doesn't happen to everybody, of course. When you start losing weight and you start at a not so high BMI, you start losing weight, your body is trying to find as much stored fat tissue in your body. And that includes fat tissue close to the tailbone. And once you lose it, it starts hurting. So you might want to try a regular cushion. This is only temporary though, okay? So keep that in mind, because you will start losing, you lose that fat, and then you come into a phase, it's called a fat redistribution phase, where fat goes again to those particular spaces. So patients there, in the meantime, use a cushion, a special pad. Otherwise, keep it in mind, it's just temporary, it goes away, and then it'll stop hurting. Last question is, can I get a gastric sleeve, Dr. A, but I've had my gallbladder removed before? So when I had my gallbladder removed, they told me to tell the surgeon of any other abdominal surgeries. I'm telling you, I've had my gallbladder removed. Can I get a sleeve? The answer is yes, not a problem. We do this every single week. We have patients that have had their gallbladder removed. It is not an issue, okay? So just let your team know, your doctor know, your surgeon know that you've had your gallbladder removed, or any other abdominal surgery, or any surgery at all. Go ahead, when you get asked by your doctor, have you had any previous surgeries, please, every single one of them. It is very important for us to know. If you had a liposuction, you didn't want your mom to know, state it, all right? If you had some other procedure, state it. We need to know exactly what you've had done before and the outcome of that, so we can plan ahead, okay? All right, so there you have it. If you found this information useful, leave me one of these. It helps me a lot. Thanks so much. All right, so hey, you want me to answer your questions? Go ahead and send me your questions using the hashtag AskDrA. I'll add them here to the queue. I'll be more than happy to be here for you and answer them. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.